Greetings! This is a presentation on Saw Palmetto by A.J. Fleming and Greg Aders.
So exactly what is Saw Palmetto? So it's a plant that's found in southeastern USA. It has a stem with about 20 leaflets around it, and it's commonly referred to as the American dwarf palm tree. What they actually use is the fruit of the plant. That's what's being used medicinally, and it was first used by the Seminole tribe in Florida. And saw palmetto supplements are, again, from those berries of the plant, the Serona repens, and about 2% of American men are using saw palmetto.
The type of people that would use Saw Palmetto are people that would use it as an alternative treatment for various urinary and prostate-related conditions, specifically benign prostate hyperplasia, which is also abbreviated BPH.
So the effects that are thought to happen when taking this are, the main action is that it's supposed to inhibit the 5-alpha reductase enzyme. So basically what it's doing is stopping the conversion of testosterone to DHT, which is just a more potent androgen. It's called dihydrotestosterone, and this is what actually creates that hyperplasia in the prostate.
There are really no known drug interactions with Saw Palmetto, and all the reported side effects are minor and very rare. Primary side effects occurring in humans are gastrointestinal distress, which is generally mild and can be minimized by taking Saw Palmetto with food.
So saw palmetto appears to have similar efficacy to certain medications, especially finasteride, which is the common medication that's being used to treat BPH right now. It's better tolerated and less expensive. That's usually why people are using saw palmetto. There are some side effects to the actual medication finasteride, such as allergic reactions, so like a skin rash, breast pain, lightheadedness, dizziness, testicle pain, swelling in the hands and feet, or drowsiness. One thing to note too though, finasteride can also be used to stop hair loss or also to encourage hair growth. So that's just another thing that it's used with.
Here's a brief overview of the research. Some high-quality scientific studies have been shown to support that saw palmetto is no more effective than a placebo in relieving urinary tract symptoms caused by prostate enlargement.
I had found a study that actually supported the use of saw palmetto. This was a meta-analysis that was done on 21 trials that they had found. The 21 studies included over 3,000 men with a mean age of 65 years. What they had was, again, these moderate symptoms of BPH and an average urologic score of 14.4 out of a possible 35. Moderate BPH symptoms are from 8 to 19, so these men were right in the middle of that. What they had found, though, is that in the 13 studies that reported symptom scores, saw palmetto improved symptom scores, individual symptoms, and flow measures more than the placebo that was given. So patients and physicians were more likely to report improvement in symptoms with saw palmetto treatment than with a placebo. So just giving my own personal recommendation on saw palmetto. For personal, I would recommend it as a drug to try as an alternative to medication. I did find, again, with that big study, that meta-analysis, that there seems to be enough evidence to support that it can help with some of the symptoms in moderate BPH and urinary issues. There's also a lot of bonuses that go with it. It's really cost effective as compared to drugs like finasteride. There's almost no side effects that can just be mitigated by using it with food, and there's also no other drug interactions that you have to worry about.
On the contrary, my recommendation is to seek alternative treatments to saw palmetto. If patient is tight on money, saw palmetto may be a good effective treatment. However, the medication has been proven more scientifically to work. Studies kind of show support for both sides of the argument, and I'd encourage the person asking me to take a deeper look at the research and just kind of make a decision for themselves based on what they see. But overall, I'd give my support to finasteride as a better primary option.
All right, so here are just some of the references that we had used. Thanks, guys, for listening.